Hello, my name is Tiffany Edelman. I'm a registered nurse with AvevoRx Specialty Infusion Pharmacy. During this video, I will demonstrate IV push medication administration with reconstitution of the medication. Prior to use, remove your medication from the refrigerator to ensure it's at room temperature. Never speed warming process by heating or microwave your medication. Clean your hands thoroughly using soap and warm water for at least 20 seconds. Dry your hands with a clean towel, gather your supplies, and place them on your clean work surface. You will use vial of medicine, 2 saline flushes, 1 heparin flush, syringe, alcohol wipes, Purist cap, a sharps container, and/or trash container. Inspect each medication, making sure that the correct name of medication, the volume or amount of medication is correct, and check the expiration date. Press down on plastic device to force diluent into lower compartment. Remove plastic cap covering center of stopper. Gently shake valve to dissolve. Clean the top of the stopper with an alcohol wipe for at the least 15 seconds and then allow to air dry. Take your syringe with your needle attached and draw up 1 ml of air. Insert needle squarely through the center of the stopper until the tip is just visible. Invert the valve, holding the valve upward, and withdraw the dose of medication into your syringe. Remove the needle from the valve. And discard of your needle in your sharps container. Next, you're going to flush your IV line with saline. To remove your Purist cap, scrub the needleless connector on the end of your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove protective cap from your saline flush syringe. Hold the syringe upright and gently push plunger to remove air from the syringe. Do not touch syringe tip after removing the cap. Attach your saline flush syringe to the needleless connector on the IV catheter using a push and clockwise twisting motion. Open your clamp on your IV catheter and/or IV extension set. Flush IV catheter using a push-pause method. To do this, push a small amount of fluid, pause for 2 seconds, and repeat until prescribed amount of flush is infused. Close your clamp on your IV catheter and/or IV extension set. Remove the saline flush and discard in a trash container after use. Scrub the needleless connector on the end of your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove protective cap from medication syringe. Attach medication syringe firmly to the needleless connector on your IV catheter. Use push and clockwise twisting motion until secured. Open clamp on your IV catheter and/or IV extension set. Inject medication as indicated on medication label. Close clamp on IV catheter and/or IV extension set. Remove medication syringe once prescribed dose has been given and discard syringe and trash can. Next, we're going to flush your IV line with saline. Scrub needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove protective cap from the saline flush syringe. Do not touch tip. Hold syringe upright and gently push plunger to remove air from the syringe. Attach saline flush syringe to needleless connector using push and clockwise twisting motion. Open clamp on IV catheter and/or IV extension set. Flush IV catheter using push-pause method. Close clamp on your IV catheter and/or IV extension set. Remove saline flush syringe and discard in trash container after use. Next, we're going to flush your IV line with heparin, if ordered. Scrub your needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to dry. Remove protective cap from heparin flush syringe. Do not touch syringe tip after removing the cap. Hold syringe upright and gently push plunger to remove air Attach your heparin flush to the needleless connector on your IV catheter using push and clockwise twisting motion. Open clamp on IV catheter and/or IV extension set. Flush your IV catheter using a push-pause method. Close the clamp on your IV catheter and/or extension set. Remove the heparin flush syringe and discard in trash container after use. Call your nurse or doctor with any questions or concerns. If you ever meet resistance when flushing your catheter, please do not push any further. Clamp your line and contact your pharmacy.